Hello, everyone. I'm Dr. Francisco. I'm alive and live in YouTube once more. This is the Kidney Health Information, Kidney Disease Awareness uh, group, video blog, or whatever you want to call it. It is destined to help patients or their relatives with kidney problems or kidney-related conditions like type 2 diabetes, high blood pressure, polycystic kidney disease, metabolic syndrome, to understand the disease better so they can be in good terms with it, take it in a better way, so be on top of the disease rather than the other way around. And also by understanding better the disease, they can be better equipped to have more meaningful discussions regarding the management with their own doctors, which can translate in less worries, less complications, and hopefully a longer and better life. So that's the aim of this group. We're discussing about polycystic kidney disease. Today is what are the symptoms of polycystic kidney disease. So I already defined what is polycystic kidney disease in the previous videos and some of the potential complications and what are the prognostic factors, etc. So let's discuss some symptoms that patients might have. Many patients with polycystic kidney disease might have no symptoms at all, and their condition is simply discovered after being assessed for high blood pressure, protein leaking in the urine or blood leaking in the urine, or because renal impairment was found on a screening test, maybe in a medical checkup, or because they already have family history of polycystic kidney disease and they seek medical advice regarding their own condition or to see if they actually have the disease or not. Most patients tend to have progressive kidney dysfunction, unfortunately, going all the way into kidney failure, then developing eventually the constellation of symptoms that accompany advanced kidney disease, like fatigue, malaise, itch, nausea, vomiting, lack of appetite, and weight loss. Some patients might also develop fluid overload with leg swelling and shortness of breath. That sometimes, if there's a lot of fluid in the lungs, this can be life-threatening as well. Some patients cannot concentrate the urine very well and pass a lot of diluted urine and thus feel very thirsty. Occasionally, the disease can be complicated with cyst rupture, and the patient can have pain at the flank, on the sides of the body, and see blood in the urine. Blood in the urine can be also due to other problems in patients with polycystic kidney disease. They can also have urinary stones, urine infections, or accidental injury to the cyst, to the kidneys. Maybe they knock on a corner of a table. And I have seen cases of some urinary bleeding after medical examination, especially by medical students. That's why I always encourage medical students to be gentle with patients with polycystic kidney disease, with every patient, but especially with patients with polycystic kidney disease. And I also motivate my patients to guide medical students or other doctors examining them to be gentle as well. No, some patients have chronic pain around the kidneys, and it is thought to be caused by the enlargement of the kidneys. Let me show you in my model. Remember this model from the previous videos? The cover of the kidneys will be this layer. Is not as flexible or elastic as when the kidney is growing, and that the tension on this cover then can cause some pain. That's called capsule. Occasionally the pain can, because the kidney is growing, this is the main arteries. So the main artery, then the arteries of the kidneys are here. If the kidney is growing, it starts sort of pulling the arteries from their origin, and that can also cause pain. Also can be a pulling of the ureter as the kidney is moving and growing. So that also can cause pain. But the pain also can come from any other organs that can be affected with this disease. I already mentioned some in the previous videos, like the bowel, the liver, and, there can be also, symptoms related to the heart, because the heart can be also affected. Patients can have also headaches and brain aneurysms. Remember those dilations of the arteries of the brain and the worries that they can rupture and cause an internal bleed in the brain, and that can be disastrous, because can cause a lot of neurological symptoms, problems, but also can endanger life. So that's in a nutshell, basically, most of the symptoms that patients can have. Obviously, specific patients can have different symptoms, etc. But in general, those are. If you have, unfortunately, this disease and you start having some of those symptoms, it's better you seek medical advice as soon as possible. So I hope you like this. If so, please press like, share the existence of this channel, subscribe to it, tell your friends, your peers that might have kidney disease to watch it. If you don't like YouTube, but I suppose if you are here, you like YouTube, but if not, if you prefer Facebook, I watch Facebook, YouTube, if you have your favorite. I also do this in a special private group in Facebook, but also have the written version. I have published an ebook that you can purchase in Amazon.com as well, with all those information in paper on Kindle. So for whoever doesn't like YouTube, Facebook, etc. So if you have any comment, leave it in the comment. You have a specific question regarding your medical condition, you can consult me as as your own doctor. For that, you will probably need to engage me professionally, but I'm also available in Singapore for that, and worldwide. In certain circumstances, we can do it through telemedicine as well. So I'm Dr. Francisco, wishing you the best possible health. Take care, guys. Bye-bye.